The phases of nurse-patient relationship represents a dimension of Peplau's theory of interpersonal relations. Initially, she proposed 4 phases: orientation, identification, exploitation, and resolution. Later, Peplau proposed just 3 phases: orientation, working, and termination phase. The working phase encompasses the original identification and exploitation phases. Orientation phase. During the brief orientation phase, hospitalized patients realize they need help and attempt to adjust to their current and often new experiences. Simultaneously, nurses meet patients and gain essential information about them as people with unique needs and priorities. The nurse's assessment of the patient's health situation and the identification of the type of service the patient needs happen during this phase. The patient seeks assistance, questions are asked, and expectations based on the patient's past experiences are shared. Nurses assume the role of stranger during this phase and greet patients with respect and positive interest. Working phase. The working phase has 2 subphases: the identification and exploitation phases. They account for the majority of nurses' time with the patients. During this phase, nurses make assessments about patients to use during teaching and when contributing to the interdisciplinary plan of care. In identification phase, the nursing care plan is developed based on the patient's situation and goals. The patient has a sense of belonging and ability to deal with the presenting problem. Nursing care plan is also implemented and actions are taken to meet the goals during the exploitation phase. Professional assistance is used for problem-solving alternatives. During this working phase, the roles of nurses become more familiar to patients. They begin to accept roles as health educators, resource person, counselor, and care providers. In the termination or resolution phase, the evolution of the nursing process with the needs of the patient being met through patient care collaboration, terminating the professional relationship happens. This is more commonly thought of as discharge planning. During this phase, the nurses teach patients about symptom management and recovery at home. Both the nurse and the patient evaluate the situation based on set goals and whether or not they were met. The success of the termination phase is dependent on how well patients and nurses navigated the orientation and working phases.